Well, radiation therapy is when we use radiation to treat patients with cancer following a prescription that was written by a physician. So the radiation is given to the patients to hopefully cure the patient. That would be the best goal, but sometimes a cure is not a possibility, and the radiation is used to relieve symptoms, and sometimes it's used along with chemotherapy, which treats the entire body most of the time, and it can be used with surgery either before or after, but administering specific amounts of radiation to the patient. The radiation treatments can vary from one treatment all the way up to like 40 treatments. So it varies tremendously how many times a person is going to see a patient, but most of the time it's, 5 to 6 weeks of treatment that a person would see the patient each day.
Okay, that's really interesting and awesome to hear. So what can someone do in this field? What are the different aspects that you could go into?
Well, it's narrow in that it's very focused in specifically to become a registered radiation therapist. So, administering the radiation to patients with cancer would be the primary goal, and that's what, like 99% of the patients, the students end up being as a radiation therapist. Sometimes they can do something in what's called tumor registry. Sometimes there's some research available. Sometimes a person can work with animals and treat, spontaneous cancers that happen in animals. And then there's ways of advancing, and one of those is called a medical dosimetrist. And that's a person who plans the radiation with the physician. And that's a step up. And those are mainly master's level programs. So it's a career path for a radiation therapist, on occasion. But it requires 1 to 2 years of additional schooling after they graduate with their bachelor's.
Okay, so with you, why did you choose the field of radiation therapy?
Well, when I first went to college, I went into radiologic technology, and that's to become an X-ray tech. And I found I didn't like it very much at all. And that's one of the reasons why we're so happy for students to investigate programs ahead of time, because I was ill-suited to be a radiographer, I think. But one of our rotations, and I didn't know anything about radiography when I was accepted into the program, really. But then one of our rotations was in radiation therapy during our senior year, and it was in an associate degree program, but so it'd be our sophomore year officially, but our last year program that we rotated to radiation therapy. And I just felt like I'd found my home, my career home at that time. And I never considered anything else, and I never thought of going back to radiography. So, that's really the reason I selected it. Was only when I was exposed to it and realized it existed, because before then I didn't even know what radiation therapy was really until I got to the department and interacted with the patients and saw what the therapist did and such like that. And that's when I made my decision.
So with that, you kind of said that it was an associate's degree program when you started it, and then you can do a bachelor's degree. So what does it take to be a faculty member in radiation therapy?
A minimum of a master's. So, a person would need a master's. The programs in the country, most of them accredited programs in radiation therapy are at the bachelor's level, but a person would just simply do a master's to be able to teach at most universities. Okay. A PhD, obviously, or a doctorate of some sort would be preferable, but those are, a little far and few between.
Okay. And so going back into like the whole aspect of you deciding between radiology and radiation therapy.
Sure.
Radiologic therapy.
Yeah.
But going back to that, what was it like trying to make that decision between the two fields and, everything? Kind of give us a little view of your view as a student and how
as both of them. Well, when I was in radiography, I was very young. I had just turned 2015 when I was in the program, and I had not had hardly any experience with healthcare at that point, and we didn't do shadowing at that time. So, you know, I was picking a field with not a lot of knowledge, you know, in essence. But radiography was very fast paced, and it was very diagnostic, because obviously they really are doing diagnostic images there. So you see a patient for a moment and do a procedure, and then you go on to your next patient. And, you know, at that point, I was not emotionally ready for that kind of fast-paced environment. And radiation therapy is a slower pace. We see the same patient, as I mentioned earlier, several times, and many times, you know, up to 40 treatments. So you get to know the patient. You know, I just felt like I was doing something very specific to help someone, either help them be cured of their cancer or relieve some of the discomfort that they're experiencing. And the emotional aspect is what really you know, attracted me most to radiation therapy. And that holds true for radiography too, radiologic technology. But at that point, I was not developed enough in my personal development to be a good radiographer. If I had been more mature and had more life experiences, I probably would have been a much better radiographer and probably would have liked it better. But it was just my first aspect, and I just really wasn't up to the task, even though I did fine in the program academically. I really was not that comfortable in what I was doing. And in radiation therapy, I had matured enough that I was ready. And, you know, it was something that was very rewarding to be able to get to know the patients a bit and to feel like you're making a physical impact on their life, but also a supportive emotional impact. And that's what I like best, I think.
So in the radiation therapy program that you went through, can you kind of just give us like what it was, like what you did as a student, some of the requirements, and kind of just give us a detail?
Sure. And one of the requirements of a program in any of these fields would be that a student have academic didactic instruction before they ever go into the clinic. And that's what, you know, I experienced, and that's what we do in this program. Students are accepted into the program in their sophomore year. And the first term, they take 4 different classes, and all of them are covering the big overview of radiation therapy and a lot of drilling down to some of the specifics. And then we also have a simulation lab where students get to practice with each other on equipment that they're going to use in the clinical setting that would begin in the spring term of their sophomore year. So there's a lot of prep work so that when they get there, they have a certain basic knowledge level and have gotten used to manipulating stuff and manipulating equipment, and they do you know, procedures on each other to some degree, you know, making masks of patients and helping move patients from table to table, all of those things, and touching another person, which in regular life we don't do. And, you know, when you're first in a clinical setting and you have to help a patient undress and see patients unclothed, it can be a little catch you off guard a bit, but this gives them some of the experiences before they actually get to clinic. And then when they get to clinic, it's graduated expectation. And at the beginning, the students would do very minimal, but they would observe and then begin the process of assisting the therapist. They always work with a therapist because the radiation can't be taken back, obviously, so there's no room for errors. So students always work with a therapist at all times in the program. They never do anything unsupervised, and they just begin to take a more active role. And then they do competencies where they actually have to show the therapist that they can do a procedure from start to finish without any corrections. So there's competencies all the time. And then there's a general evaluation where the students are evaluated on how they interact with patients and their professionalism, and, you know, just a whole host of other activities that, that they're evaluated on. And they are evaluated daily. so that they get feedback each day how that day went from the therapist perspective of their interaction with patients and their ability to jump in and do things. And so they get immediate feedback each day, and then a final evaluation, and then the competencies are a part of it. So the clinical part of the program is the part students seem to like the very best, and it's what I liked the very best, because you're actually in there with patients. And if it's the right place and the right fit, it's a wonderful environment for a person to, for a career.
So with like going into like the student aspect, as a faculty, what is your favorite part of working with students as a faculty member in the radiation therapy program?
Well, I think it's twofold. Part of it is the academic part, where students master the didactic portion of the program. And for instance, in our first year students who are just beginning their sophomore year, this week I had a test with them. Well, last week I had a test with them, and at the beginning, there's always a learning curve of dealing with a new instructor, but this was their third test, and the score was, I don't know, like a 95 to a 99, something to that effect. So, I sent them a congratulations announcement and told them we would have to discuss in class what went right and what each one of us did right on this exam. And, so we spent some time today talking about that, and how what I had done for that exam had been helpful, and, what they had done that had been helpful, and, just that learning piece. So that was wonderful. And then also this week, I was in clinic with students that are in their junior year, and, they've now had they're in their third term of being in clinic. And I'm always so amazed, because the technology is so advanced for radiation therapy now. And, in the process of when I became a therapist to now, it's night and day different, the technologic advancements and requirements. But the students, that I was with this week in clinic were just simply running the machine. And they were doing everything. They were evaluating the images to see if they were still treating exactly what they were supposed to be treating, and operating the equipment. And the students that I saw this week and have seen all this term, it's like they were just a new therapist. They weren't perfect, but they were very good. And that was just so heartwarming to see how well they have done. So, in both settings, teaching a student when something clicks and makes sense, that's, I think, the rewarding piece when you get to that point. And then we're not always there, but when we get there, it's wonderful.
That's great. And I know that at NKU, we have the simulation center, so that allows us to give our students quite a bit.
Of course.
Compared to when you were at school. Can you kind of give us a little bit of detail about how that helps you as a professor or a faculty to teach students?
Go ahead.
Get them kind of prepared for after school.
I'm sorry, I lost part of that.
Get them prepared for what life is like after school. Give them that real life experience.
And I think the simulation, we use the simulation lab some, but for the most part, we use the simulation in the radiography department. They have a CT scanner, and that's what we use in radiation therapy to initially decide the area to be treated. The physician decides the area to be treated. So we do CT images, and can replicate in large part what happens in the simulation. And the students have found that, extraordinarily helpful to get them ready to start clinic, in January when they come back in spring term. But, the clinical piece, when they're actually in clinic, and in our program, they're in clinic 7 semesters out of the 8 semesters. So they get continuous exposure of dealing with different equipment, different centers, different ways of doing the same thing. So that, and our students rotate, we have 14 affiliates, and the students will rotate to at least 6 of them. So they're going to work with different therapists, different physicians, different equipment. And hopefully by the time they leave, they will be very well-rounded and can adjust to whatever clinical setting they go to. The other good aspect about our clinical sites is that they're potential employers for the students, and that's the reason they want to be part of the program. They would like to help the program and help the profession, but also they have a very real investment in getting to see the students as they're learning and getting to know them better so that they can offer them jobs. And ordinarily, that's how people end up getting jobs, is by excelling in clinic. So I tell the students, even though it's a little scary, that it's like every day they go in, it's a job interview, you know, and in reality, it kind of is. It scares students, but they also know that they can meet the challenge. And it makes it very real that everything they do does make a difference in their, you know, potential, you know, future employment. So I think all of those, it helped the student be ready when they graduate, you know, that they just have seen and done virtually everything. So we think that's a helpful part.
I can't agree more. So with St. Elizabeth, I understand that they now have a brand new cancer center.
Mm-hmm.
Have your students got to interact with that very much?
Oh, they do. Yeah.
Okay. Do you have any examples of, you know, that experience they may have shared, or how that transition with St. E has been?
Yeah, well, it's been perfect, you know, in reality. I was the former director of the program at the University of Cincinnati before it was closed. And in that program, we were always, St. E's was always part of our program. So I'm very familiar with them. Even, you know, our program is very new here at NKU, but I've worked with those therapists for many years. And actually most of them, practically all of them, have graduated from the UC program that I used to be in charge of. So they're very familiar with the policies, you know, in our philosophy on working with students and such. And St. E's has been wonderful of being very inviting to students, being very cooperative. They have 4 treatment units, and well, they have 3 right now, and they're getting a 4th one. And it's a new unit that's the first one in the greater Cincinnati area, called a Halcyon unit. And it's just a more sophisticated way of delivering external beam radiation therapy. And they have CT simulations. They have state-of-the-art equipment. And all of our students go there. You know, we will have all of our students go there at some point during their, you know, 7 semesters. And, you know, it's just been perfect, really. They're very accommodating, and they're very receptive and supportive of students.
That's great. Anytime we can obviously get continued education to our students, even outside the university, is amazing.
Mm-hmm. Mm-hmm. Sure, absolutely.
So kind of pulling it in, why is radiation therapy important?
Well, I think from the perspective of being one of the 3 primary methods of treating patients with cancer, the survival rate for cancer, according to the American Cancer Society, overall 5-year survival is almost 70%. And patients are living longer with cancer now than what they did in the past. In the past, sometimes patients, and it still is true today too, but in the past, more likely that a patient would die of their disease at some point. But now they're living longer, and cancer is thought of as being a bit of a chronic disease. Many times, not always, but many times, where patients live with cancer for many years. And that calls upon radiation being a part of that treatment. So radiation therapy, as I said before, can either be with a curative intent or a relief of symptoms, or what we call palliative intent. So radiation is incredibly important, potentially to cure, but also to improve the quality of the patient's life up until the time they die, if a cure isn't a possibility.
Okay. And with that, I know I'd asked if you had done any research, but what are potential research opportunities that radiation therapists can take part in?
Mm-hmm, sure. And it's something that's ongoing, and evidence-based practice is something that all medical fields is following now. So trying to do research into the emotional aspects of a patient's diagnosed with cancer and how to help them, or this very specific physical different ways in which radiation can be delivered. For instance, a patient with prostate cancer could be treated a number of different ways depending on the stage of their disease and what we call the grade of their disease, which is talking about how aggressive the tumor is. So they could be treated with surgery, limited surgery, or extensive surgery. They could be treated with radiation, either where the radiation is put inside the patient's prostate with a radioisotope. And the more confined you can make the radiation, the less side effects there will be to the surrounding normal tissue. Or it could be external beam radiation therapy. So, you know, researching ways in which the radiation can be best delivered and the most safely delivered with the least toxicities and the greatest control would be a way of, would be an avenue of research for that is ongoing. You know, it never stops as far as new ways of treating and what ways might be better.
So we've kind of gone over radiation therapy and all of the profession, and then also your kind of journey through radiation therapy. One thing I would like to do is kind of spotlight you. So what are some of your hobbies or interests to kind of give us that kind of connection and, you know, give you a tangible human feel? Because most of the time, professors, we kind of see them as overwhelming persona.
Yeah, well, I mean, the overwhelming persona, I can relate back to when I first started in radiation therapy and in radiography, that I was very awed by my professors and such like that, and thought of them as being very different from me. But in reality, I think what you're getting to is that we're not different from anyone else. We just happen to have an area that we found our niche in life, and an area that we presumably excelled in. But I think, you know, from that perspective, I've always been just very grateful for the job that I have. And, you know, a large part of my life is revolving around being a radiation therapist and now an educator in radiation therapy. That's how I kind of identify myself as being. Otherwise, I think of myself as a grandmother. That's probably the most important aspect of my life now, still being a mother, but also a grandmother now with grandchildren. And I just visited during the break, those 2 days in Florida with my grandchildren. And then otherwise, gardening, reading, you know, that type of thing. I like novels of all sorts, so, you know, I like that. But I probably am fairly simple in my thinking, and I don't do anything special, you know, just live a life is all I do, so.
That's always wonderful when you can kind of make that connection. Is there anything else that you would like to kind of talk about or give us information about radiation therapy or just about you yourself?
Well, I think for radiation therapy, what I would always suggest for prospective students is to observe in radiation therapy as soon as possible, because as with all careers, it's the right job for some people, but the wrong job for someone else. And it's a very demanding job. You have to be right every day, every patient, and that's very challenging. And, you know, the ramifications of an error can be monumental. So, and then the emotional aspects of helping the patient. Some people don't like that aspect. They would rather be in an area of healthcare where they do their job and then they go on to their next patient. This one, you're going to see the same patient, you know, repeatedly. And sometimes that's wonderful and sometimes that's challenging. Either the patient may be quote, difficult, which, you know, I say with hesitation because we think every patient has a right to whatever their feelings are, but they may manifest some of their difficulties in anger, and sometimes that's hard to take, or sadness. You see things that are very sad, and sometimes we're not well equipped to handle that. For instance, this week when I was in clinic, there was a child who was being treated, her total body. She was 1 year old, and she was having what's called TBI, total body irradiation. And it's because her leukemia was so advanced that the only way she stood a chance of surviving is to have a stem cell transplant. And, you know, that's just sad every time you see that, you know, because the dad was walking the child in and, you know, carrying the child in. And, you know, it's like that's real. That's life and death. And that's what happens sometimes in radiation therapy and with any healthcare related field. But a person has to be ready to compartmentalize when necessary to do their job. So that's the reason we think shadowing is critical for the student to make a good judgment about what they wanted to do, and you know, to get the right place. Because if a person isn't happy with their job, they're not going to be the best therapist possible, and patients deserve the best therapist possible. So, you know, we're very supportive of students making an informed decision. So I think that would be my takeaway, is to learn as much about the field as possible and not just be dazzled by salary, you know, because the salary is good, and that's important. That's an important consideration in picking a career, but also satisfaction with the job is equally important. And, you know, that's a piece that, you know, should be explored, I think, and to learn as much about it as possible ahead of time.
And then is there anything about yourself that you would like to share? We've kind of gone over your past and everything like that, and your hobbies, but is there anything you missed? I know quite a journey.
Yeah, it is. Well, I've been in the field, you know, for many years, and I was retired until this program was picked up by NKU, and they needed someone to be an interim program director, which I took so that we could get started. And now we have a permanent program director, and I'm now the clinical coordinator. And I'll be here for a year or two until we get accredited and you know, sort of ease through some of the developmental pieces. But, you know, I'm happy to be here, and I'm happy to be back at work. So, you know, we feel grateful for our jobs, I think, is what I guess I would want to convey.
Well, I'm actually going to put up some links that you had shared to me
Sure.
more about radiation therapy in our chat. And then I will also share those out to our students and also to our teachers. That way they can share it with more to get the word. With all of this, and obviously with radiation therapy, it's very important because cancer is something that happens. And I didn't know about the whole stem cell aspect of radiation therapy either. So that's obviously really have you ever experienced like something to where a student is just so engaged, so ready for the program that you feel a sense of accomplishment and you were super excited about, you know, their career path and how that impacts your future education for other students? And then with that, how do you kind of share those stories with your current students to kind of help them understand that, you know, you're going to be okay in this field? Field is really important.
Yeah. And I think, you know, as far as the engaged part for students, you know, I think a piece of that is like I related seeing them in clinic when they are functioning as a therapist with direct supervision and they're actually doing the job. I think that's very important, and the process of them getting there, and the when they're very uncomfortable when they first go into clinic. They're uncomfortable with the therapist they're working with because they don't know them. They're uncomfortable with patients because they haven't been around them very much. And they're very concentrating on what they have to know in order to deliver the radiation, that sometimes they miss the emotional aspect or the affective part of the field. So I think all of those are very important, and the growth that happens. And I think what we most commonly help students with is to just help them through any of the challenges that they have as an individual, and get them past whatever is a barrier for them, either in the clinic or in the classroom setting. And encouragement is incredibly important, because every now and then when someone is a student, they feel like they can't do the job, they can't learn all of that and whatever. And I think encouragement and trying to figure out how best to adjust to a person's learning style without compromising the educational process, I think is incredibly important. So, you know, we give, you know, I've known of thousands of stories, because as I said, I was a therapist as an educator for like 40 years. So, you know, we've had tons of students, and I've seen all kinds of issues. I had a student who was a radiographer who then came into radiation therapy, and she was very bright. You know, she was very good at her job, and she was already able to work with patients since she'd been a radiographer. But she was afraid of clinic, and I couldn't understand why. And so, you know, we talked and talked, and finally she told me that she was so afraid that a patient might vomit in front of her, and she was afraid she wouldn't be able to respond correctly. And you know, I thought, oh, this can't be, you know, you'll be okay. But no, she really wasn't sure she would be okay. And so we ended up getting her some meetings with a psychologist. This was when it was at UC, you know, to kind of work through her fears of seeing a patient vomit, and then that she would still be able to help the patient. And of course, she went on to become a very successful radiation therapist. And then she went on to become a medical dosimetrist. And, you know, but it's just, you know, you treating each student as an individual, the same as what we want every therapist to treat each patient as an individual. The same thing holds true for us as educators, that we have to help each person any way we can to address what they need, I guess. So I don't know if that makes sense or not, but that's sort of our philosophy, and that's just one example.
That's great. Last question, then I'm going to open it up to everybody.
Sure.
So all of our attendees are middle school to high school range. What is something that they can start doing now to kind of get them prepared into the field of radiation therapy?
In high school. So what they would need to do is concentrate on math. Math is incredibly important, and it's a requirement for the program. We use a lot of math in our physics courses, so a person needs to get as comfortable with math and begin to love it. And sometimes people don't love it, but you have to at least appreciate it and become technical, have a certain skill level there. Physics is important in radiation therapy. So if you can get to a physics class, that would be very important. Biology, incredibly important, because that's where cancer rises, is cells that are in the body. So, and then when we treat patients, we have to know the anatomy. And I mentioned earlier about the images that the therapist evaluate each day on the treatment unit. They have to know anatomy and what it is and where it's at and what it looks like on an x-ray or a CT. So biology, anatomy, and physiology would be very important. And those would be kind of the hard sciences. Chemistry, you know, is good, and it's very important in the A&P classes, anatomy and physiology classes that are in the first year of the program. But science-based classes, I think, would be very important because we assume all the English and all of those are going to be happening anyway. So that's what I think would be helpful. And if a person could volunteer in some sort of a healthcare setting, I think that would be very good. The sooner a person is able to be comfortable with another person in a very healthcare related intimate setting, the better. So I think that would be very helpful to someone if they could do that. They could volunteer at a children's hospital potentially. They could volunteer at a hospice. You know, there's all kinds of volunteer opportunities, maybe not as many right now with COVID, but hopefully that'll change in the near future and people can get back into volunteering. And I think that would be helpful. I think it would just help with understanding. And just a quick little aside, when I was in high school, we had candy stripers at that time, and I became candy striper. And they put me in various places in the hospital, and I didn't work out at any of them. I was very, I empathized too strongly with the patients, and I was in tears half the time and whatever. So finally they ended up putting me at the front desk, that I just saw people as they walked through the door to go visit the patients. So one would never think that I would have ever been able to work in a healthcare related setting based on how I was initially. But I grew and I matured and I became better. And I think sometimes that's a process for some of us, and it was for me. So I think that volunteering piece would be helpful to many people.
That sounds great. Thank you for giving us that little bit of information. I'm pretty sure that the students will really take away from that.
Sure.
So with that, I'm going to open it up. If you have any questions, feel free to unmute yourself if you would like, or you can go into the chat. Oh, we've got one already. So Edward wants to know, how does the radiation actually work in regard to what it does to the mutated cells and other targeted things?
Sure. And what it does is the radiation is carried in what's called photons, and they carry the energy. And what the energy does is break bonds, the DNA bonds, and that causes the cancer cells to die. It causes any cell to die. That's the reason in radiation therapy, the radiation is as closely confined to the tumor as possible, because radiation is damaging, and that's obviously a very good question. It's very damaging to all cells. But there's characteristics of the cancer cells that make it a little more sensitive, and it's part of the replication rate of how fast it reproduces. And cancer typically reproduces faster than the surrounding normal cells, so the radiation will have a greater effect on those cells. So, it just destroys the cell from within by damaging the DNA and causing mutations that are unsurvivable in the best circumstances for the cancer. Good question.
Feel free, like I said, feel free to throw them up in the chat, or you can unmute yourself. You should be able to unmute yourself at this point. Do you guys use a lot of, you were mentioning stem cell. Oh, we've got one. Jean wants to know, what is your favorite aspect of the job?
I think it probably is the affective part of helping the patients and treating the patients with tremendous respect and empathy. And, being older, I've had experiences with many different healthcare settings, and I've seen when healthcare workers do their job physically and technically, but they neglect the emotional aspect and the needs of the patient. So I think that's the part I like best, and what I like to see best in students is that a person who can combine both and do the technical aspects as perfect as possible, but also keeping in mind that the patient is still the focus, and their emotional needs are tremendously important, and that can't be overlooked. So I think, it's two things, but I guess if I had to pick, it would be providing the emotional support to the patients each time you interact with them, even if it's just being kind to them. There's an expression, to be a little kinder than is absolutely necessary. And I think that is what I think a healthcare provider should be. They should go the extra mile to do more than just the technical aspects of their job. Good question.
Yeah, that was a great question. Thank you for asking that, Jean. You'd mentioned stem cell. Is that something that is regularly practiced with radiation therapy, or is that procedures?
Sure. And stem cell transfusions is when a patient is able to receive radiation treatments or chemotherapy in doses that would essentially cause the patient's death if they weren't saved by getting stem cells. This is nothing that a therapist would do, and we wouldn't be involved in it. We're just part of the preparation of giving radiation to a patient that a dose that's unrestricted by what the bone marrow can handle. So it's a stem cell transplant is given to patients who have very advanced disease, or it's just, from day one, it's a very bad disease. And leukemia is one of the examples, as I said, with that child that I saw this week, but it's used for other tumors. But what we call the liquid tumors or leukemias are one that is used a fair amount. So, therapists, it's a scary proposition when you think of it from the perspective of you're giving a dose of radiation to that person, to their whole body, that would be lethal if the stem cell transplant didn't work. So, but it's a person who has a survival rate of essentially 0, and it can be up to 60 to 70%. But 30% of those patients are possibly going to die. And, but that's their best chance for survival. But that's, a very advanced, extreme treatment for select patients with cancer.
All right, we've got time for one more question. If anybody wants to ask something. While we're waiting, I will go ahead and talk about our next, it's going to be a hot topic. It's going to be with Bethany Bowling, who is in our Biological Sciences program at NKU. She's going to be talking about race and genetics. So it will be next Friday at 11. And everything. So we're really excited to have that. And I think it kind of coincides with Carolyn's talk today, looking at cells and radiation. So the genetics aspect and everything like that. So I think that that'll be a good follow-up to this. And if you join next week, maybe you can ask Bethany if there's any kind of genetic components that kind of increase your chances for being susceptible to cancer and everything. So I'm pretty sure that that'll be a great talk to attend. And I'm not seeing anybody else ask any more questions.
Okay.
So what I'll do is I will thank Carolyn for coming, obviously. We really enjoyed hearing about radiation therapy, and we enjoyed hearing about your story and your interests, and just it was really nice to listen to what you have going on as far as the clinic setting and how that helps our students. So thank you. And we actually have one question pop up. Jean wants to know, what is your, oh wait, nope, she's just commenting, just saying it was very interesting and thank you. Which I agree with. It was very interesting hearing all the different aspects of radiation therapy. So, again, thank you for attending, and I'm very happy that you were able to make it today.
Oh, I'm happy to.
I release you because now if you can stay, or if you guys want to stay around for a tour of the NKU campus, Abby Leonard, I totally hope I said her name right. She is here to give you guys a tour of campus from the student perspective. So please sit back and enjoy.
All right, hello. So yes, I will be leading the virtual tour. So I am going to share my screen and pull up the virtual tour. It's going to take me 1 second to do this. Awesome. Okay, here we go. All right, so here we go. So the first stop, sorry, it is twirling around, but the first stop is the Welcome Center. So before I start talking about the Welcome Center, to introduce myself, my name is Abby Linhard. I am a junior here at NKU. I am a math major with a minor in the Honors College. And then some other things about me, I am involved in Greek life, presidential ambassadors, and leadership